Labiaplasty. Are you one among them who have ever thought to get it done in your life? So come, let's discuss about it. So starting with the external genital anatomy. So we have two labia majora, two labia minora. So labiaplasty can be labia majoroplasty or labia minoroplasty. Minora is the inner lips which is seen, which is covering the vaginal opening. So what happens to these labia minora? Sometimes it will be this small, sometimes it will be too long. Either one among them can be long or both can be long. Or post delivery, the lengthening can happen. So there are a lot of concerns which these organ or a tissue can cause. That is either a cosmetic concerns that when you're wearing tight clothes like gym clothes or yoga pants or swimwear or a legging with a short top. So these labia minora, if it is too long, might be prominent when it is under a tight fitting clothes. So this can cause a lot of reduced self-confidence or a discomfort wearing such clothes. So coming to the functional concerns, it can also cause difficulty in having penetrative intercourse that might obstruct when having an intercourse. Or sometimes when you're wearing your clothes or removing your clothes, it might get stretched and can cause pain. Sometimes when only one lengthens, it might be creating a problem as pain as in itself. So these are the concerns where you have to think about a labia minoroplasty. So now coming to the procedure or surgery as such, labia minoroplasty is a minor procedure which can be done under a local anesthesia. That means local numbing is sufficient to do this procedure. So basically, when we post a patient for a labiaplasty, pre-surgical investigation is a must for any surgery. So few blood tests will be done and an optimal date post-menstrual cycle is selected, and then we post for the procedure. This procedure is a daycare procedure which, as I told you, can be done under local anesthesia. Local anesthesia is basically numbing the local area only, and once the local is given, we start with the trimming of the labia minora. So if it is only one, we target only one, which will be trimmed to a level of the opposite labia minora. Or if both of the labia minora is of the concern, we trim both the labia minora. Trimming means we do with laser labiaplasty. Laser comes with more precision, less of collateral damage. So that's a preferred advanced way of doing a labiaplasty. So once the excision is done, usually we suture that area. Suturing means stitching that part. So it will be a very fine suture material what we use, and delicate sutures are applied wherever the excision of the labia is done depending on the concerns of that particular patient. Because labiaplasty is always the customized trimming is what we do, because labia as such comes in different forms. So whatever the patient is convenient with, we do a procedure depending on those concerns. So once the procedure is done, now you need to be knowing about the post-op care. Immediate post-op, we do give you some medicines, that is antibiotics and painkillers. Pain will be to a certain level bearable, but yes, you might need certain amount of support. So once that is taken care with medicines, from your end you will have to take care of the perineal hygiene part, that is the local hygiene. You have to keep it very dry, that is no rubbing but only dabbing. Every time you use your washroom, you have to dab and keep that area dry. You will be provided with ointment which you can apply over there, and also perineal washes which you can use it to keep that area clean. For the pain, you can also use warm water bags also, which will reduce the pain in that area. And you'll also be advised that no anything which is penetrative, that is use of tampons or menstrual cups or sexual activity to be avoided for around 4 to 6 weeks. And also avoid any strenuous activities, that is trekking, hiking or two-wheeler. All these, it's preferably to be avoided. So this is roughly about labiaplasty. So basically you need to know that labiaplasty is a minor procedure. When chosen for the right reasons and done with a trained hands, it definitely improves your quality of life and your confidence also.